The most common reason to spend the night in a U.S. hospital, maybe not surprisingly, is to have a baby. And the second most common reason to spend the night in a U.S. hospital is actually to be a baby. But the third most common reason to spend the night in a U.S. hospital is something related to sepsis. In fact, it's the number one cause of death inside of U.S. hospitals. Somewhere between 20% and 50% of the patients who end up with this syndrome end up dying as a result. And if you put all of that together and you spend some time with a health economist, they'll tell you that it's probably a 27 billion with a deep B problem, $27 billion problem in this country. And so as we think about the burden of this disease, we know we have to catch it earlier before it requires a highly dramatic response. We know we have to catch it in such a way that allows caregivers to operate at the top of their license. And of course, we have to do it in a way that restores and retains the dignity of patients who are faced with this disease. So it's a big financial burden, and it's a very real personal burden for the individual patients.